body mechanics on how to lift and move people during your career. You also are usually asked to do a ton of in-services and talk about proper lifting forms. And the majority of the population out there do not use correct form. Okay, so proper use of our body mechanics and core stabilization will conserve energy for us. It reduces stress and strain on our bodies, reduces the potential for getting hurt, and will produce a safe spine and keeping you safe. Now, this being said, remember that we can't always predict what our patients are going to do, and so you need to be in control of the situation and be telling the patient what we're going to do. But you can still get hurt, but you will greatly minimize your risk if you have good body mechanics. Okay. It is the action of the core muscles contracting together that will stabilize your spine and your pelvis during movements. We want to keep a neutral pelvic alignment. That is key for any times that we're doing lifting. You want to make sure you maintain upright posture and keep your spine safe. Okay, so you don't get a back injury. People that are in physical therapy and occupational therapy, or anybody that has to do a lot of repetition of an activity, such as lifting, construction workers, we are already a higher risk of getting injured because we are doing it so often. Okay, so tightening the core muscle group, so your transverse abdominis muscles, contracting that, your diaphragm will increase the pressure within the abdomen. This is what helps stabilize our spine, and it's important for us to do this to prevent getting a back injury. So you gotta contract your abs before you're doing your lifts. Body mechanics can be described as the use of one's body to produce motion that is safe, like I said, and energy conserving, maintaining good balance and control. Patients should be taught to breathe normally when they're performing any kind of activity, including the lift themselves. I don't know if you guys have heard of, but it's called Valsalva phenomena. That is when you hold your breath, the air is trapped in the thoracic. That increases your thoracic pressure, and it will decrease the return on the venous blood supply back to the right side of the heart. That decreases the cardiac output, but that increases your peripheral blood pressure. So what does all that mean? It's making your heart work significantly higher. It's really hard on the heart. You're also at a higher risk of having a rupture in some of your vessels, specifically the brain, so having a stroke because of it, or having a heart attack. So we want to teach people to breathe. You also need to breathe. A good way to remember that is to count. So if you've ever lifted weights, you usually exhale, right, and count when you exhale. That is why, so that you're not causing this phenomenon to happen. Okay. It's also the reason that they tell you if you're on the toilet and you're trying to push, strain to poop, you shouldn't be doing that because you could cause yourself to have a heart attack. Okay. Principles and concepts for proper body mechanics. Before you attempt to lift, think about pulling, reaching for, and carrying an object. The following are the two actions are required for proper body mechanics. Position yourself so your center of gravity and the object's center of gravity are as close as possible. So you want to also increase your base of support. So that means making our feet go wider, and then we want to lower ourselves so our center of gravity is closer to the middle of our base of support. So gravity and friction are the forces that are adding resistance to many of the activities, such as lifting and reaching. So we want to make sure we counter that as best we can. So our center of gravity is the same as center of mass. Sometimes the book talks about both of it. It's actually the same thing. So center of gravity versus center of mass. You you just want to, and you want to know that each body part technically has its own center of mass. So like my arm would have its own center of mass, but when we're talking about the whole body, we have a center of mass that is usually just slightly anterior to the sacrum at S2, okay? So it's pretty low. It's like right down in here would be the location. So we want our body to, we don't want to shift over to one side or the other, because then our center of gravity is not where it should be, right? We also want to make sure our base of support, so our feet are as wide as possible to give us a good base of support. When we pick up an object like that, your center of gravity is going to go toward that object, right? Because they've just added mass to your volume as well. Remember that your center of gravity is then going to be forward toward that object. Principles and concepts of the proper body mechanics. Remember, position your center of gravity as close as possible to that object. Will help reduce the torque required to move and carry an object. So less torque for us is less energy, which is a good thing. We're going to have less likelihood of having a strain or some kind of injury. Achieving stability by tightening our core muscles is going to help. It also, we want to lower our center of gravity, increase our base of support. There is a vertical gravity line within all of us, so think of that as where your upright is. We want to keep that as low as possible, right? Down and low. You don't want to have things that are top heavy. Remember when you were building Legos when you were a little kid? You don't want things to be tilted at the top, right? We want our center of gravity down and low. So we want to squat, stoop, or kneel in order to achieve this. Sometimes we can't achieve it just for ourselves, like we need the patient to do that, so that's when we want to raise or lower the bed to help us, so that we prevent ourselves from getting hurt. Remember, when the upper extremity is positioned away from the body, when you're attempting to lift or push, this requires the muscle extremity to perform the task. It's going to cause a larger torque on you. So if you have the object way out here, it's putting a tremendous amount of pressure on your low back. So you want to pull everything into you, okay? So that you don't put a lot of torque on your joints, like your shoulder and your low back. So everything that's out far away, we need to get right up close to it. That's why you're so close to your patients when you lift them. You can put your feet, the book talks a lot about an anterior and posterior stance, one foot in front of the other. So if these are my feet, you need to make your feet wide. You can have them parallel to each other. A lot of times during transfers later in the semester, we'll talk about we're going to have one anteriorly and then one posteriorly. This just helps with base of support, and it also helps you if you're trying to perform like a transfer and moving the patient to the opposite location. It helps with keeping your center of gravity still within inside you. It also helps with balance issues. Okay, so anterior and posterior helps. It's actually preferred versus just being parallel to each other. So you want to make sure you're wide and then slightly one anterior and one posterior. So most upper and lower back injuries are caused by small repetitive motion trauma that has happened over many, many times, okay? So we do micro damage that we don't even know about, and then we overuse the back. So this is a great example. My dad's best friend and neighbor, he, for like 70 years, did stuff like just would lean over and pick stuff up, right? Picking up heavy objects, used his back. One day he decides to pull a weed for his wife, leans over, and like 3 bulging discs popped right out. And he couldn't stand up. And he was like, it wasn't even heavy, it was a weed. I literally was trying to pull a weed. And he had done micro damage for years And that last time he leaned over was just enough to let those discs go, okay? So the reason it's so important for us to consistently do this correctly is so that you don't have that repetitive damage. You wanna make sure you keep a neutral spine when you're lifting. Most of us are anteriorly rotated. So if you were in my lab yesterday, I kept telling you to do tuck, right, do posterior tilt. Very rarely do you come across somebody that is in neutral. Most of us have just gotten a tendency, I'm exaggerating, most of us have gotten a tendency of anteriorly tilting just by our lifestyles and sitting and such. So make sure we want to keep that spine in neutral. We want to keep that pelvis in neutral. That's the safest thing for us. Flexion of the hips and the knees. The lower your center of gravity is the most helpful. It also makes you lift. So if you look at this picture, you can see her leaning over. All this pressure is right there on that lumbar, probably L2. That's where she's getting all her pressure from trying to lift that. Since she's squatting, she's now got her center of gravity between her, and now her legs are going to be what lifts her up, right? So we also want to make sure we talk to our caregivers. A lot of times you have to teach family members how to help patients with transfers, so we want to make sure that we teach them good body mechanics as well. Gravity and momentum can be used to help us whenever possible. So sometimes we want to rock an object back and forth to help us with momentum. It also help you conserve energy. So sometimes you also need to roll the patient, slide them, push or pull an object. Pushing is always easier than pulling an object. So anytime you can, you want to try to push if at all possible. Remember that we want to give good verbal cues to whoever's helping us so that they understand that as well. The only internal force that a patient can help us with, or yourself can, when you're doing a transfer, is muscle contraction or muscle tension. Everything else is an external factor for us. So like gravity, the height of maybe the bed if we can't adjust it, friction of the surfaces, all those things are external factors that we can only change so much of, and so the only thing that's internal that we can use is a contraction of our own muscles to do the lift, okay? It's always a good idea to try to estimate what the weight of the object is. So sometimes tilting it, sliding it just a little bit to see. I'll be quite frank, when I do my chart reviews, I look at patients' weight. And if you're over 200 pounds, that's my limit. It's my number that I'm like, okay, if they're gonna be dependent and I can't get them up, if I set you up on the edge of the bed and you were 250 pounds and it's not going well, at this point, I know I shouldn't lift you by myself. That's my cutoff. So you guys kind of have to find your own cutoff on what you feel like is your limit. You might say it's 150 pounds, you might say it's 300 pounds, I don't care. You just kind of have to figure out what you can manage and what you can hold. So if I had that patient up on the edge of the bed and it's not going well and they're not able to hold themselves up and they're 250 pounds, what am I gonna do? I'm gonna say, Ms. Smith, we're gonna lay back down. We're gonna take a little break and I'm gonna go get help, okay? I'm gonna lay her back down, I'm gonna go get somebody else to help me, whether it's an aide or another PT or what have you, and then come in and do the transfer together. So make sure you know how much the object is and how much you feel comfortable lifting so you don't get hurt. You want to make sure when we're having to do any kind of lifting that you give it your full attention. That way it's the safest possible. You want to make sure you position the equipment as close together as you can. Make sure that an object that is below the level of your waist and that must be lifted, you make sure that you squat first and raise it if you can at all. All right, that's going to help. You must perform within the known limits of your physical ability. Like I just said, And you need to make sure that you ask for assistance. It's okay to go get a lift, y'all. You're gonna feel guilty the first time you do it, but the first time you tweak your back and your back hurts, you'll be glad that you started using lifts or a sliding board or some other device to help you, okay? So make sure you ask for assistance. So we're gonna talk about different lifts now. So the deep squat lift, you position your hips, they go below the level of the knee. You're gonna straddle the object so those legs are going really wide. Feet stay parallel to each other. You grasp the object on the opposite sides, and you're gonna, then the lifter's trunk is maintained in a vertical position, right? So we're protecting her back, her pelvis should be in neutral, right? And then we're gonna use our legs to stand up and to extend, okay? Power lift, you only do half of a squat. That's the big difference in this one. So the object would be higher, right? So the object's on that stool. The hips remain above the level of your knees when you're doing the lift. Your feet are still parallel. You'll grasp the object, keep your trunk in neutral. You're upright still, and then you use your legs to stand up. Straight leg lift. This one is, I don't typically see this one used a whole lot, but you can use it. The lifter's knees are only slightly flexed, kind of slightly flexed down. You pick up the object, the lower extremities are either parallel or you're usually straddling the object. So like if you look at her, she's kind of bent down like this, and then you're coming up. So you're more in a straddle. Most people, you're not gonna, you'll do an alternate of the traditional lift in this. So it's just not, the object's gotta be pretty high for you to be able to do this one correctly. One leg stance lift, or the golfer's lift, most of us have done this, right? You stand on one leg, the objects should be pretty light, and you should stand on one leg, flex that leg, and you lean over and pick it up. I always think of this one as when you're getting the golf ball out of the hole, you're leaning over like right, and you're standing on one leg to do this. The object should be light if you're gonna try this attempt. The half kneel lift. So you're gonna align your body, you kneel down on the floor, and then you will grasp the object and bring it up and put it on the leg that is in the front lunge position, and then you stand up from there in the lunge. I always think about, you'll see this used the most when you're trying to pick up a child. Like you squat it down and the kid comes run over and gives you a hug, right? They're usually on your leg, and you kind of stand up from there. So. Traditional lift, remember that we want our feet wide, so most of the time they tell you that your feet should be like 2 feet separated. Most of our lifts are always our feet are 2 feet separated, so 20, 24 inches apart. The wider we are, the better our base of support is, right? You don't want to get super wide, like we don't want to be 3, 4 feet wide. So you want to squat down for this one as well. You flex your muscles in the upper extremities. You're going to lift the object and then push up with your hip or with your hips and your knees. Remember, straddling the object is helpful if you can, because you're getting it closer to your center of gravity. So, to me, traditional and deep squat are very similar in the power lift. So in lab, you just do a deep squat, because that one's all the way to the floor, and the traditional one is, to me, a power lift. Because most of our patients, you're going to be in somewhere between the power lift and the traditional. So I'm not gonna have a test question that says, what's the difference in these? I'm more like, do you guys know the mechanics of this, okay? And can you teach your patients to do these correctly? Another safe lift is gonna be a stooping lift. This is when the object's off to the side. You kind of do the same thing. The object, it rests below the level of the waist, right? The person partially flexes their hips and knees. The lumbar spine is still gonna stay in neutral. The feet are positioned at shoulder width apart. Usually you have it, I would say you're similar to like a mini lunge. So you got your feet one in front of the other, right? And you're gonna squat down or do a mini lunge down to pick the object up. The thing that's not great about this lift is then your center of gravity is gonna be shifted over toward that object. So this is the best way to pick up like groceries off the floor, right? So for our patients, if they've had a back injury, this might be a lift that you wanna teach them to do, okay? We're not gonna lift our patients per se this way though. So pushing, pulling, reaching, and carrying. You want to use a semi-squat position if you're going to push or pull. The force of the push or pull should be parallel to the surface of the object is being moved on. So we don't want to push down on an object. If I'm trying to move this table, we're not pushing down, I'm not lifting up. I should be squatting myself down so my center of gravity is down, and then I should be pushing parallel to the floor because that's the direction we're going, right? We shouldn't be lifting it up and we shouldn't be pushing it down. By doing that, you're reducing the effect of friction on that object that's being moved across, okay? A lot of people typically say, well, I'm gonna lift the table up and then I'm gonna push it. Well, when you're doing that, you're actually causing, you're lifting them, and you could actually cause more friction because you think about that table getting lifted from one end, the other end is getting pushed down, and so it's gonna get a drag and you're actually creating more force on the opposite side. So the position you're in is gonna lower your center of gravity near the object, right? Increase your stability, reduce your energy cost, and then improve the control of the object. Remember that your center of gravity should be near the your center of your base of support. So within you, we always want to make sure that we let people have bigger bases of support if their balance is off. So when I say that, remember sometimes we need to give a patient a walker. That is what's increasing their base of support, right? That makes them more stable. We prefer not to reach for objects over our head. If you have to, it's the best option is to actually get a stool, step up on a stool so the object is not as high. So if I can if I'm trying to grab an object up here, and we all do this, right? We try to get something off the top shelf and then we're pulling. It's actually a lot of pressure on your low back to do that. So if you would actually just get a step stool and the object is then closer, right? It's gonna be much easier on us. So make sure you're using your stools. Wider base of support, even when you're on the stool, is important. An object at arm length away should be brought in because that helps with the force on your low back. When you carry an object, you want it to be as close as possible to your center of gravity. Remember, where's our center of gravity? It's at S2, just anterior to that disc or that vertebrae. So we want to have everything down right here, right, on a waist level. Good posture, strength and flexibility are important for preventing back and neck injuries. We want to avoid chronic sprains, so we don't want prolonged tension on any of our muscles. And how do we get that? Usually it's poor posture. And I'm guilty of it too. I will tell you, since I started teaching, I can feel my shoulders rounding. I can feel the pressure, so we all do it, unfortunately. So we want to make sure that we educate our patients as well on posture. So you can take a plumb line. The next slide will tell you if we put a plumb line up to somebody, in lab, we don't actually use a plumb line, but it would be best if we did. So the last one on this is the ideal alignment. That is, if we were to test and put a plumb line up, it should go slightly anterior to the ankle. It should go slightly anterior to the middle of the knee. If we were to measure the knee, it should go just a little bit in front of that. It should hit us right through the greater trochanter, go through the trunk, the shoulder joint, go through the bodies of the cervical vertebrae, and then it should go through your ear. So a lot of us have forward head, and so you're going to have more of a look of like here. So our plumb line is not going. So if you had lab, you guys kind of did this, and you'll do it today too, but you're going to see it, how somebody's posture is. Okay. Posture sitting, because sitting is a ton of stress. It's actually the worst position for your low back. Okay, it's worse than standing, walking, prone, any of those things. There's a tremendous amount of stress on your low back. It is important that we teach people how to sit properly, and stand properly, right? So what would be good sitting? It would be making sure that we're not anteriorly tilting those pelvises, right? We're doing a posterior tilt right there, having a neutral spine. And then we're going to have our chest open, so we pull our shoulders down and back, right? And then we're going to tuck our chins down and back, right? So we have good posture for our head as well. The other thing is a lot of us are typing, talking on the phone, and so we're already at a predisposed position of pulling those shoulders in, right, getting our chest really tight and our neck forward. We want to make sure we're educating our patients on posture. So sustained standing and sitting, poor posture can cause lots of different issues. We want to make sure we observe them. We want to evaluate them. Even if they're not there, they might be there. I've had patients come in and tell me they have shoulder issues. Well, they have shoulder issues because they've rounded their shoulders for so long that they're getting impingement because it's getting so tight and pulled down in. So we have to address posture as well, not just the injury, in order to stop it from continuing to occur. You want to make sure you give them verbal and written instructions. And then suggest proper, even talk to them about like their work situation. What do they have to do, and how can they make it so that they have good posture during those long activities. Simple exercises that we want people to make sure they do are just going to be shoulder blade retraction, right? Chest stretches. We're going to stretch this. We're going to strengthen their backs, right? For like rhomboids, lats, all those. We're going to do posterior pelvic tilts. Everybody's anteriorly tilted, right? So we're going to teach them how to do a posterior tilt and hold that. And then we want to make sure we're stretching like the low back. So that's single-legged chest, those exercises laying down. And then you want to teach them core stability things, so like partial sit-ups, any kind of core stability exercises. And then we want to teach them hamstring stretches, because if you're anteriorly tilting the pelvis, our hamstrings on the back have been stretched, right? So we need to make sure, well, it depends. A lot of them get stretched out. Some of them get tight if they're sitting too long. So you have to evaluate your hamstrings and make sure whether they need to strengthen them or stretch them. And then make sure hips, they do hip extension because their hip flexors are going to be tight, right? You can do wall slides, push-ups, or press-ups, wall slides as well, the neck glides, and then core stability exercises. Make sure you teach them low back exercises as well. So for stretching is big, and then moving throughout So most of us should only sit in one position for like 30 minutes. Definitely after 2 hours, we need to move, right? Y'all learned that last week. And that goes for work as well. So if they have a job that they're gonna have to sit at, we wanna teach them to get up and move or reposition or at least check themselves every 30 minutes. Reducing back stress, we want to, sometimes we can give them options like setting one foot up on a stool like this gentleman is doing to do an activity. Actually helps your pelvis go into a posterior tilt, right? So we're going to counter that anterior tilt. It's going to help him reduce stress on his low back from standing, all right? So sometimes we give them things that will help with that. Sometimes you give them a special lumbar cushion or a roll for sitting activities to give them extra support. Then you want to make sure you educate them and talk to them about not twisting to complete all their tasks if they can, like in the proper mechanics of body lifting, right? So they're flexing their knees and their hips so that they don't hurt their low backs. Okay? Are there any questions? All right. We have lab with me today. We start up here and then we go downstairs.